Please can you remind me if you'll be so kind, staring out into space, asking God to hear my case, trying to think of all things past. How long will my memory last? The purple angel, purple angel, purple angel, you're next to me.
Well, hi, everyone, and welcome to Alzheimer Speaks Radio. This is Lori LeBay, and I am your host and founder. My mom had dementia for 30 years, and that just really hit home with me and made me switch careers. I believe very strongly that all voices need to be heard if we are going to truly change the trajectory of this disease and how we care for one another. So welcome. For those of you that are new, Alzheimer Speaks is an advocacy-based company, and our platforms are all about trying to shift dementia care from crisis to comfort around the world. We're also known as a media outlet, and we help businesses expand their brand footprint because of our audience. And so as you're listening to this, if you wouldn't mind liking the show and sharing it with your peeps, if it's on Facebook or Twitter or LinkedIn, wherever. It's just so important for people to hear the resources that are out there and available. And even if they're not in their own neck of the woods, sometimes it gives somebody in your neck of the woods an idea to go ahead and create something a little bit better. And so, again, I just want to thank our audience so much because you have really broadened our footprint, and this has just been an amazing journey. I also want to invite you to be maybe our next guest because you probably have a story too, just like everybody else. So reach out to me. You can go to alzheimerspeaks.com, and there's a big contact button there. And go ahead and shoot me an email or call me. I'd love to talk with you and hear about your story. Now, before I introduce our guest today, I also want to give a shout out to Dementia Action Alliance. They are having their second North America Dementia Conference, June 20th through the 22nd in Atlanta, Georgia. And they're all about reimagining dementia, about engaging, empowering, and enabling people with dementia. And so their conferences actually have many speakers living with the disease. And it's been a pretty profound experience, even for people in the industry, to hear what they have to say, what their wants and needs are. So check out daanow.org for more information. I also want to give a shout out to the Memory Cafe Directory. They are doing an amazing job. They've pulled together over 600 memory cafes, which we now have in the U.S., which is incredible. And it's free to do that search. And if you've got a memory cafe and want to be listed, they would be more than glad to get you in there. Just go to memorycafedirectory.com. And last, I want to give a shout out to Purple Table Reservations. This is a new movement started out east by a daughter who had a mom with dementia and also owns a restaurant. And she just thought restaurants can do much better accommodating people with special needs like dementia, post-traumatic stress, autism, etc. So she's designed a program to assist people, and there's actually an app if you go to purpletables.com to find out more information about that program. Let me go ahead and introduce our first guest. We've got a fairly large panel today, which I'm just so excited to have with us. Gretchen Reeves has been a speech and language pathologist for 28 years, and she specializes in the evaluation and treatment of cognitive communication disorders caused by dementia. And that was really instrumental in the creation of the Chippewa County-Montevideo Hospital Memory Care Clinic, which was created in 2008. And Gretchen also facilitates a caregiver support group and has written several local, state, and federal grants for dementia support services and provides dementia education on both the local and state level. So welcome, Gretchen. How are you doing today?
I'm great. Thank you for having us.
Well, I am so excited. Lori Petersen, who I'm going to introduce in a minute here, was the one who introduced me to you and your group, and she just raved about the work that you have done and the changes that you have made in the community. So kudos to you. I can't wait to hear more, but I'm going to introduce some of the other panelists here. Next, I want to introduce Melissa Anderson. And Melissa is an occupational therapist, and she's been one for 14 years. And she has also worked at the Memory Care Clinic on their team since 2011. In her role at the Chippewa County-Montevideo Hospital, she serves all ages and populations, but has a special interest in working with older adults living with memory loss and also their care partners. So Melissa is really active as a member of the Montevideo Area Memory Loss Network. So welcome, Melissa. How are you doing today?
Great. Thanks for having us.
Well, I'm excited that you can be here with us as well. Thank you. Next, I'm going to go ahead and introduce Gregg Waylander. He has been a family nurse practitioner in the Montevideo area for 20 years, and he's been part of the CCMH Memory Clinic team for the past 8 years. And Gregg has a general family practice, and he feels like the Memory Clinic is an invaluable service to his patients and families and the healthcare providers. So thank you for being with us today. How are you doing, Gregg?
I'm good. Thank you. Good to be here.
Well, great. We have just such a wonderful variety in this team. I'm just thrilled to be able to have you all pulled together with us today. Next on the Montevideo team, I want to introduce Lori Petersen. She's the one who is raving about this group to me, and I have worked with Lori in the past. Lori grew up in Maynard, Minnesota, and graduated from Concordia College in Moorhead with a BA in elementary education. And then her mother-in-law got diagnosed with Alzheimer's disease, and she really felt a need to set up more memory loss awareness and networks in various communities. And she has just been so active and just a true joy to work with. In 2015, she was hired by the Chippewa County-Montevideo Hospital as their memory care coordinator. And she links people up with memory loss and their caregivers to different resources that are available to them. So you just play a real essential role in the whole team. So thank you, Lori, for taking the time to be with us as well.
Thank you. It's great to be included in this broadcast.
Thank you. Last, I'm going to introduce a father and daughter team who we are really lucky to have. And they have experienced the clinic from a family's perspective. And so we are just honored to have with us Jack Knothe, who was married to Donna, who had dementia, and Karla Mohagen, who is Donna's daughter and is the daughter of Jack. And Donna lived with dementia for several years and has since passed away, but they are still very active and were willing to talk to us about their experience. And they have worked with the memory care team in several different capacities that they'll tell us about a little bit more. And they've gone through the evaluation process at the clinic and received the outpatient occupational and speech therapy to help Donna. And they have also been part of Gretchen's support group and attended local community-wide dementia education events. So they are known at the clinic as the poster family for the clinic. So welcome, Jack and Karla. How are you today?
Great. Thank you for having us.
Yes, thank you very much for having us.
Well, I'm thrilled that you could be part because, again, Alzheimer's Speaks is about making sure everybody is connected, and we can't do a dang thing if we don't include the families and those with dementia. So thank you so much for being with us. I want to kick off the questions to get a little bit more background. So I'm going to go to you, Gretchen, first. You know, you were really one of the original team members going back to 2008. So I want you to tell us, how did the Memory Care Clinic evolve, and what was your role in the team itself?
Well, as a speech language pathologist, back in the late 80s and early 90s, as a profession, we weren't doing a lot with memory care, but so I had to educate myself quite a bit because I saw a need for that when I moved to Montevideo in 1997. And one of the physicians here at our clinic had a patient who was a resident at our local nursing home. And his wife wanted to know if he still knew her. And so the physician asked me to go evaluate the resident at the nursing home and see if I could help the wife in any way to answer that question. So speech pathologists have a couple of different evaluations that we can do to help us know where a person's communicative strengths and weaknesses are. And so I conducted that evaluation and was able to learn that the resident recognized his wife in their wedding photo and could name her in their wedding photo, but didn't recognize her in their most recent church photo. And so that was enough for his wife to be content that he still knew her. It was from their wedding photo, but that satisfied her curiosity. And in that process, we put together a memory book. So she and I compiled several photos from his past and put them into a book. And he went from pretty much being nonverbal, because he was in the very advanced stage of dementia, pretty much went from being nonverbal to having a conversation with me by using this memory book. And so I just, at that moment, realized I had something that I could offer. So since then, 1997, I've just been slowly increasing my knowledge, increasing our services here, and adding staff that have a passion like I do for this area. And it's just evolved over time.
Wow, that's fascinating. And how exciting. I mean, that had to just be exhilarating to be able to see that connection come alive like that. Can you tell us how does somebody get referred to your organization?
Well, our services are billable to Medicare and private insurance as well, but most of our patients are 65 or over. And in order to be able to bill our time that we spend evaluating and helping the patients and their families, we have to have a referral from a medical doctor or a nurse practitioner. And so in most cases, that's a piece of paper that is sent to us through our computer or faxed to us from outside providers. And then we get that referral and we call the patient and their family members and set up the appointment.
Okay, great. Then once they're at the appointment, what can they expect? What all does that entail?
Well, it's evolved over time, but the way we are doing it now, and we found to work the best, is it spans across 2 days back to back. It's about 2 hours of an evaluation and some interviewing the first day. And they are evaluated by myself and Melissa, the occupational therapist. And then we also spend that time interviewing the family members. And then the second day is about 3 hours. And the patient and their family members are seen by Gregg, Waylander, in our clinic, in the regular medical clinic for an appointment. And then that's followed by a care conference where we all get into the same room and share our results and give recommendations. So we might give, a lot of times people are looking to see if the person has dementia or not. So we might assist with a diagnosis. We might assist them with maybe they already have a diagnosis of dementia, and we're able to decide which services in the community might be helpful for them. Really, our goal is to help the person be able to live and function as safely as possible in their environment. So we might give living recommendations as well.
Okay. So do you go out to their home for that interview, or does that happen at the clinic too?
That happens here at the clinic. Yep.
Okay. Okay, great. Well, I'm going to ask the other team members what their roles are. And Melissa, I'm going to pull you in next. If you can tell us a little bit about what would people expect.
So my role is to evaluate how someone's cognition or thinking skills is impacting their ability to get things done during the day. So an older adult who is living in their own home has a lot of responsibilities, from pretty simple basic things like getting up in the morning, getting dressed, making breakfast, to more complex things like managing healthcare and their medication regimen, nutrition, meal planning, meal preparation, driving. And so really what I'm looking at is how their thinking skills help them get through those tasks. And specific thinking skills that I look at, they're called executive functions. So being able to pay attention to all the steps that you need to complete to get through a task, being able to organize and plan your day, or different things in your day, like making a meal. That takes a lot of planning and organization. Problem solving. It's more often than not that we run into a little glitch in our day. Maybe we're driving and we run into some road construction and we need to problem solve our way out of that. So I'm really looking at how those skills help somebody get through their day smoothly and successfully. And the test I administer has 7 different tasks that I actually take people through. And what I'm looking at is how are they able to use those skills to get through each task in a really specific way. So I give very specific directions to complete the task. And the tasks are they seem pretty mundane: making toast, washing hands, following a map. But they have to follow my really specific directions and be able to pay attention, organize their thoughts, plan, problem solve to get through the task. And if they're having difficulties, maybe they're getting frustrated, or I see them make a mistake, I jump in and give them help. I might simplify the task or give them a little hint. The amount of help that I give to them helps me predict how much help they're going to benefit from in everyday life to get through their days, everything that they're responsible for doing and that they want to do. So my role is to evaluate cognition in terms of getting through their activities in their day, but also finding a way for them to still participate to their full capacity, even if they're living with memory loss.
So when you do your evaluation, is the family present, or is the person alone with you?
I spend an hour with the patient, and I get to know them a little bit, their past roles, habits, routines, and then I administer that test. And then after that, while Gretchen is evaluating the patient, I also spend an hour with the caregiver or family member, friend, to get their perspective on how the patient is doing, so I can identify what the biggest challenges are, what their questions are, what their goals are, so that in the end we can provide personalized recommendations.
Okay, great. Thank you. And Gregg, can you tell us about your visit with them? That's on the second day. What can somebody expect? And do you just meet with the patient alone, or do you meet with the family as a whole?
Typically, I meet with the patient for sure, and preferably with family, 1 or 2, or sometimes there's 4 or 5 family members that come. Usually by the time I see the patient, I have seen and read the reports from Melissa and Gretchen, so I have a fairly good idea about what brings them to the memory clinic and what some of the challenges and questions are, and some sense of how they've done on the testing, which tends to kind of help drive me in a direction. I think my main goal when I meet with a family and through our process is to answer the family's questions. And usually that has to do with what's going on, how bad is it, and then what can we anticipate. So my goal is to really 2 things. One, to not miss or make sure that the provider that's referring isn't missing something that we can correct, some sort of reversible cause of the patient's cognitive difficulties. So I do that through a little bit of evaluation and reviewing history, looking at medications. And then my second goal is to actually make a diagnosis. We as a team have made a commitment to trying to give people a name. If we think it's Alzheimer's type dementia, we use that language. If we think it's frontotemporal, we try to use that language and try to give some people some tools. So that's my goal, is really to make a diagnosis, make sure we're not missing something, and then I make recommendations back to the referring provider. For example, if we're making medications or changes medications or some other testing.
Okay, wonderful. And then Gretchen, I'm going to pull you in because I didn't ask what exactly can people expect from your evaluation?
Well, what I do is I focus on how their cognitive impairment is impacting mainly two areas. First of all, memory, which is kind of the classic symptom that we hear about when it comes to dementia. But what a lot of people don't realize is that cognitive impairment, like dementia, very frequently impacts language. And language is divided into four areas. So someone who's having cognitive challenges may have difficulty speaking. They may have difficulty finding words. They may have difficulty putting words together to make a sentence. They may get lost in their train of thought when they're speaking. They might say words that they don't intend to say. Another area of language is comprehension. So someone with dementia may have difficulty understanding the words that people are saying to them. A third area is reading comprehension. So someone with dementia is very challenged being able to read and comprehend the meaning of what they're reading. And then the fourth area is spelling. Many times people with dementia start to lose their spelling ability. So I'm looking at language. I'm looking at their ability for new memory. So I will read a short story to them, and they have to tell it back to me, and then they have to tell it back to me about 30 minutes later. So I'm not looking at long-term memory or remote memory. I'm looking at what's their ability to hear something new for the very first time and remember it. Just like you and I would have a conversation, you might tell me something about your family. Am I able to remember that in 5 minutes? Am I able to remember that the next day? So those are primarily the two areas that I'm looking at. And we look a little bit at visual perceptual abilities. So sometimes people with dementia, their brain doesn't always make sense of what's coming through their eyes. So it's not the clarity of vision like you would get with your glasses or your contacts. What's your brain, how accurate is your brain telling you how far away an object is? Or is an object moving or standing still? It gives us a little bit of information on depth perception. And so my test looks a little bit at that.
Okay, wonderful. And then, Lori, are you there for the care conference, or do you meet with the family at all?
Well, yes, I am involved in the interview portion. So when we interview the families, when Gretchen and Melissa visit with them, I sit in on that so I can get to know the families as well. And then once they have had the visit with Gregg, and then the team comes together, we have some discussions and try to lay out what the recommendations would be for the family. And then we bring the family in for that care conference, and then I'm a part of that care conference as well. And I was able to join the team just 3 years ago, a little over 3 years ago. Some grant dollars became available, and that's how my position came to be. And then during the care conference, if I am part of that recommendation and I can be of assistance to the family, then I would work with them more so than the person with the memory loss, but more with the family, reaching out helping to follow up on the recommendations that we make at the care conference, maybe helping them find some other resources that could help them keep their loved one in their home for as long as possible, and maybe even just helping the caregiver understand things better, finding some respite opportunities for the caregiver, just connecting them and trying to educate them on the process that's happening with their loved one, and how they are not alone in their journey, but how I can help them through the journey.
Great, thank you. And I would be amiss if I didn't pull in Jack and Karla, because I was through this process with my mom, and it was very intimidating, and there was a lot of anxiety, not only for my mom, but I think for us as a family. How did this process go for you? And I'm going to point this question first to Jack and then to Karla.
Well, I suppose I sought out some help. When I saw my wife, Donna, we had been married for a long time, 63 years, and so we spent lots of hours together. And I suppose I saw certain things deteriorating, as, for instance, we had a daily treasure hunt. And you might guess what that would be. And I tried to make it that way without putting undue stress on her. And of course, things were misplaced. And of course, I knew they were in the house someplace because we hadn't left the place. And then, of course, she kind of gave up on driving. I think she realized that she wasn't capable anymore to do some of the skills needed to carry out a skill of driving. Reading the newspaper became looking at the pictures. Numbers, which was something that she favored, was another thing that deteriorated. She liked to work with all those things. She was busy writing letters and so forth, so she used her challenging things in her life on a constant basis. We feel nothing but very positive about this group of people that you just interviewed because of their approach to us, and when we sought out some help from them, even to the point where they came to our home and made suggestions on arrangements of things and so on, how to make our life a little bit better. And then even showing us, me especially, how to approach Donna when she was frustrated about things and how to change that. We received some written reports from them, which was helpful, so that as you walk away from any visitation, you can't remember everything. So if you can refer back to that report, then that becomes a good resource. I guess as the time went on, I looked back and said, well, now how far have we come, or as far as Donna's losing some of her abilities. So I went back to them a second time, at least it was over a year later, and had her reevaluated, which helped me in dealing with her on a daily basis. They, to me, have the right personality to be able to deal with people. And I think that was the key thing that drew me to them. I'll let Karla make any comments that she would like to make at this time, because I tend to talk too much.
Okay, thank you, Jack. Yeah, Karla, if you can tell us about, the kind of the debriefing after these 2 days of assessments. What were you feeling during this process and while you're sitting through that meeting?
Well, I'd have to say the first time my mom went through it, unfortunately, I was not part of it, but we ended up going through it a second time, as my dad had mentioned, and I was obviously real involved in her, the disease and some of the things that she was facing. But I was very impressed with everybody that I did meet with. They gave us a really good understanding of what we were going to be dealing with. And at this time, it was probably the later stages of my mom's Alzheimer's that we had this second diagnosis done. And in that meeting, I can remember, and my mom was actually part of it, which I was a little nervous about, because I thought, her being in the room Is she going to understand what we're talking about, or we're talking about her? But it really didn't affect her. She really didn't have any emotion one way or the other. But in that conversation, they came to the conclusion as a group that it was probably time for us to look for other living situations for my mom, and place her in a home so that it wasn't such a stress for us to take care of my mom, and especially for my dad on a day-to-day basis. So it was a little scary to think of that next step, but I felt comfortable with the professional information and experience that they gave us. So we worked real closely, especially with Lori Petersen. I think we had that conversation, and within a month, we ended up placing my mom in a facility. But during that month, we had an opportunity that Lori met with us. We looked at our various options within the community that we are in, and what would be the best fit for my mom.
Great, thank you. Now, Gregg, I want to throw a question back to you again. How do you feel that your evaluation, your neuropsych evaluation, is different from others out there?
We mostly think of it as an alternative. We live in a small town of about 5,000 people. The next large tertiary setting is at least 3 hours. We're about 5 hours from the Mayo Clinic. For a lot of families, it's just a big burden to try to get that kind of work done. So we've done a fair amount of looking at the testing that Gretchen and Melissa do, and then the process we do. And we felt like it's a pretty reasonable alternative for most families. Periodically, we have patients that are a little more complicated or don't fit a pattern, well, we will recommend a second evaluation. But for most of our families, the evaluation that we do answers the questions, and we come with a diagnosis that's helpful for the referring provider, gives the family the information they need, and it's just a way easier option. I think another uniqueness about it is that, especially with Lori and the follow-up, that we just become a part of the process for the family. We don't make a diagnosis and then say, come back in a year, which has been a real strength and gift for a lot of our families, I think.
Wonderful. Now, Melissa, I'm going to throw this next one to you. Can you tell me what you see as the most valuable aspects and outcomes of the evaluation process and the team that you've collected here for families?
I think there's two things going along with what Gregg said, being able to give more than a diagnosis. So the amount of time that we spent interviewing the patient, interacting with the patient, interviewing family, we really get a good feel for what they might be faced with each day and what the challenges are. And so with that information, in addition to the standardized testing, which provides us with objective results, it's not our opinion, we know that that's how their brain is functioning. We can give extremely specific, personalized recommendations so that the family has some answers. They can take some sort of action, and sometimes they get a little bit overwhelmed. They might not be prepared for the information that they're getting, but that's why we have Lori, so that we can continue to work with them for as long as we need to afterwards. Another benefit I see, and this is a really unique setting, the collaboration between Gretchen and myself. For the most part, when we do our testing, our results kind of fall along the same on the scale. We use the Global Deterioration Scale as an education tool. So usually our results match. But sometimes, because we evaluate different things, Gretchen focuses on communication, speech, language, I focus on function. Sometimes Gretchen's testing results maybe are the patient struggled more than mine. And then we can really find a specific diagnosis. For example, we've had a patient that's come through here, and Gregg has been able to make the diagnosis of primary progressive aphasia. And we would have never been able to do that if we didn't have both of our testing to get the full spectrum of cognition. In that way, we feel that we're able to be very specific also, not only giving a diagnosis of just general dementia, but maybe what type of dementia.
Wonderful. Thank you. Gretchen, how about you? What do you see as the most valuable piece of how your group works differently than most?
Well, since we've been doing this process for over 10 years now, we are kind of a well-oiled machine. And we've had people come to us and say, well, we have a speech pathologist, we have an occupational therapist, we can send the person to a nurse practitioner. Why can't we just do that? Well, we've learned, as a team, we've learned over the years so many things, and we know a lot about particular types of dementias, like Melissa was saying. As a team, we're able to discuss the person's strengths and weaknesses. We're able to rule out reversible causes, and just, I guess, like with anything else, if as a team we're experts, and you just can't go to any speech pathologist and get the same information, because they do a lot of other things. And to be an expert in this field really takes a lot of years of experience, and that's where we outshine, I think, as a team.
Well, that makes a ton of sense, and I love this concept, because one of the biggest issues I hear people say all around the world is that they're not getting enough from their doctors. They're not getting enough education. They don't feel the exams are full enough. They don't feel the families are included. And it really just sounds like you guys are doing a wonderful job. Lori, I want to ask you, because I'm sure you've got something to throw in here in terms of what you think is most valuable in your process.
Well, I really enjoy, my position in doing the follow-up with the families. And I also should mention, too, that I don't just help our CCMH patients or those that come through our memory care clinic. I can help people throughout the community and even throughout our area. And the best part is that my services are free. So if I can be that person that can help direct people to what they need, then I'm doing my job. Sometimes that would be to direct them to the memory care clinic, because I really feel that it is important to know where the person is in their journey, because by knowing that information, families can communicate better to that person, and we can support that person with memory loss much better, because as the disease progresses, we need to change too. And by changing how we interact with that person with memory loss, will just allow them to be more successful for a much longer time. And so it's rewarding for me, and I'm just really pleased to be part of this team and the work that we're doing out here in rural Minnesota.
Wonderful. Thank you. Gretchen, did you have some comments you wanted to add?
Another bit of information that I think makes us unique is we didn't have Lori's and her position for many years. We just added the memory care coordinator role to our team a few years ago. And we were finding that even through this process, this 2-day process, and possibly coming to a diagnosis, educating the patient, educating the family, we were still sending them out the door and then not knowing what happened, and not knowing if they followed through with our recommendations, or if they did, were they helpful. And so Lori's position is invaluable. She's been able to make a connection with every patient and every family member that comes through our doors. And then she's able to maintain that relationship afterwards. This is a disease that changes every day. And so having her there as a a contact person after the evaluation has just been such a positive addition to our team. So I just wanted to add that part.
Great. I can see where that makes a lot of sense. Jack and Karla, what do you feel is the most valuable for you in terms of lifting you as a family in this process?
I think along with their help, which got us off on the right track, I think, when we sought their help, is our family support. I think in talking with Gretchen one time, she told me that we would make it with our situation. And I think that was on one of our Alzheimer walks that we had, because our whole family was there to support us. And that remained true throughout the situation. I could relate to you many different times when the family member stepped in and gave me support as a father to them, and the grandchildren as well as the great-grandchildren were involved. And so they remembered Grandma and treated her as such, as Grandma yet, which was an important thing. She wasn't forgotten.
Great. Karla, anything you want to add?
Well, I really got a lot out of the support groups that both Gretchen and Lori put on. It was nice to be able to be surrounded by other individuals that were going kind of through the same process for being caregivers of loved ones that have dementia, and really being able to kind of discuss their situations and maybe some things related to what we were doing, or maybe we could provide support to them. So that was very encouraging and very helpful. Another thing, too, that they did a great job with is being able to bring in like national speakers to the Montevideo-Wilmer area that we could participate in. And we learned so much from the speakers on just day-to-day activities we could do with our loved one, or how to communicate with them. And then as the disease progresses, what are some of the different tools that we will need? So they did a great job of promoting a lot of education, and that was very, very helpful.
Great, thank you. Gretchen, did you want to add any more in terms of what happens after, the initial meeting? Is it pretty much just Lori and then they touch base with you guys, or are they getting services maybe from you and Melissa?
So sometimes after we go through the whole process, the 2-day evaluation, we're making several different kinds of recommendations, from maybe what level of support the person might need to live safely. We might recommend, Gregg might make some medical recommendations as far as further tests that might need to be done, or medication recommendations. But one of the areas that sometimes we recommend is for the patient and their family members to come back and see Melissa and or me for some education primarily. So I can speak about the speech pathology recommendations. So what I do is I have the patient and their family members or friends, whoever is closest to them, come back and see me in my office as outpatients, and I educate primarily the family members, because they're going to be able to learn and retain new information probably better than the person with dementia. But I educate them on communication strategies. For example, almost every family I work with has someone who says, well, Mom just isn't listening, or Mom, don't you remember we just talked about that? Or I just told you that. We just talked about that. And so I educate the family members on how really that's a reflection of their frustration. And just by saying those phrases to your loved one is not going to make them remember better. And so I have a lengthy list of those communication tips that I educate the family members on, and we practice in my treatment room, with the goal of increasing communicative success between the patient and their loved ones, and reducing communicative frustration. A lot of people come to me and say, I can't listen to my mom ask me the same question 10 times in 10 minutes. I just can't do it. And so we talk about ways to try to solve that problem. And then I'll let Melissa talk about her part.
Okay, great. I'm going to add a couple of things in. I just interviewed a woman called Judy Cornish, and I've had her on the show before, but she has a book out called Dementia with Dignity, and she has something called the Dawn Method, and it's really helpful for both professionals and for families to understand how to communicate. And she talks in depth about focusing on kind of measuring mood and focusing there in terms of, we can control our mood, but somebody with dementia can't always, but that might be a good resource tool for you. The other thing I was thinking that might be a good resource tool is something I created called Your Memory Chip, because I was one of those daughters that wasn't always gracious when my mom would repeat herself 45 times in 10 minutes, and I felt horrible snapping at her one time, and I thought, I've got to be able to do better. So I created this tool, and it's just something that I literally used before every interaction with her, if it was on the phone or in person. And a lot of clinics and families are using this now, and it's totally free. But the first question is, what do I want this person to know? And it can be used for staff or for family. And for staff, it's we're here to support you. For family, it's typically that I love you. But our words aren't enough. We have to use our multi-senses to engage them, to help them remember us. So it might be cologne, it might be touch, it might be tone of voice, it might be a saying, all these different things. And then the second question was probably the most powerful, and that is, what do I need to focus on as a care partner? And I thought, I got this down because everyone's rattling off their to-do list. So I felt really good going, okay, I got this down. And then one night I woke up in a cold sweat, realizing that I don't have this down. And what I missed in everyone's voice was this subtle little twang that said, this isn't how I pictured my life. And I realized in that second that we can't be person-centered. We can't be totally relationship-based and trying to give them the best possible care when we have an emotional need. Because as humans, we always take care of ourselves. So I had to switch from focusing on my checklist, and not that those things didn't have to get done, but instead I had to focus on three simple things first. Was she safe? Was she happy? And was she pain-free? And when I focused on those three things, then I did my tasks differently. I found I could give some of them up. I found that I had time constraints that I put on that weren't important. And then the third question is, what do I want to remember? Because so many families are worried that they're not going to remember the person who was. And so that's about capturing the moments, especially nowadays with our phones. We can capture video and audio and picture, and making sure that we're looking for the joy and not letting that slip by because we're so busy. So I just wanted to plug both of those things in. So back to you, Melissa, in terms of after the big meeting and when you do your follow-up, if you could fill us in on that.
Sure. So there's two areas that I can help with primarily, and I really see the benefit in doing follow-up therapy in the patient's home. When I go to their home environment, I can just learn a lot by looking around, looking at maybe past, pictures, photo albums, the way they have their space set up. And in terms of just getting through the day, I can help caregivers with maybe challenging situations that they're presented with. If somebody doesn't like to take showers as often as they would like, how can we encourage the loved one to get through that process? And another big piece is engagement. As people progress through the disease, they're not able to, and they don't enjoy previous hobbies or interests like they used to. And so to try to keep them engaged during the day, especially when they're at home, is challenging. Watching TV isn't always the best engagement. So looking at past interests, maybe they used to like to play bridge. Bridge probably isn't they're probably not able to do that anymore, but how can we get them to play some sort of card game or some sort of activity that makes them feel like they have a purpose? It might reduce frustrations, reduce boredom. And so I really enjoy working with patients and their family members in their home environment to just get through those days smoothly, but still be engaged.
Well, and I would think being in the home environment just puts a whole nother light on that. Jack and Karla, was that something that you needed? Did Melissa come out to your home to assist, or did Donna not need that type of assistance?
Yes, I thought that that was very helpful when under visits. I guess it would have been nice if I would have tuned into our local facility that we had available to us, and I didn't really know about this originally. It's kind of interesting, Gregg talked about going quite a distance to get other help, and we had it right in our backyard. It's like the old saying, the grass is always greener on the other side of the fence, and here we have a really good resource right under our noses. And so it takes a lot of time to educate people this way. I guess having a background as a teacher helped me a whole lot with my wife. And so I guess one of the things I did have as a teacher was patience. And but now the patience is good, but then how do you apply that? And I picked those things up later with the team here. One of the things that Melissa talked about, and Gretchen, and then the remembering different things, and then be patient to repeat. Or maybe we have to diffuse that question that comes back to you so many times, and we have to get them on another subject or another idea. Anyhow, those are some of the things I think that they provided with us, and just how you approach somebody physically and knowing where they're at in that particular position, so we don't become a threat to them. Somebody just walking up to them. And these are some of the things I think I picked up along the way. Karla?
Yeah, both Gretchen and Melissa spent some time with us at my dad's home, kind of looking at the surroundings, sitting around the table and kind of discussing how we need to communicate with my mom and going forward, giving us some tips, as Gretchen mentioned. We did some role playing as well. And they did a great job of providing those services to us. I can remember one day Gretchen sat down with me, excuse me, and we looked at pictures, and she just said, just take a picture off the wall and just talk about the picture. Don't talk about who's in the picture, but just point out just some things. Oh, isn't that pretty, that flower, or what that person's wearing? And just hoping that is going to trigger some memory. And so she gave us some really good tips on how we could just do some really simple things within our house without trying to get my mom feeling that she's intimidated or not remembering something, but by just taking pictures off the wall or finding something maybe that she really liked looking at. They gave some really good tips.
Yeah, and that's so nice, because so many times as family and as friends, we end up posing a question and it's threatening because there's a right or a wrong. And when you go in open-ended like that, it just makes it so much more comfortable. Gregg, for you, when do people connect with you after an appointment?
Typically wouldn't see the patient again unless there's some specific question. My role is really just to make recommendations to their primary care provider. But then I'm available as a resource to that provider. They might have some questions. But generally, once the conference is done, I don't have contact with the patient or family unless they're a patient of mine.
Gotcha. And Lori, I want to throw to you, what do you see some of the biggest challenges being in this process in helping families?
I think probably the biggest challenge is to getting people to get over the stigma And if they're having some difficulties, that they reach out and get help earlier. So often, by the time we're able to help people, they're in those latter stages. And if we could help people earlier, maybe getting them on some medication a little bit earlier to help slow things down, helping the family to understand, helping the family to bring in resources that could help better support that person, it would be much better. So I think probably the thing that I would like to see more is just that people come if they sense that there's some problems for themselves or for their loved one, that they reach out and get help earlier. You know, if it were any other part of our body, if we wondered about our heart, we would be racing in right away and having the doctor check us out. And the brain is just as important. So if we're having some concerns or questions or wondering, I wonder if this is normal aging or not, why not come in and have that question answered?
Good advice. Good advice. Jack and Karla, can you tell us what were your biggest challenges as a family?
I think our biggest challenge we noticed probably right away was medication, the medication management. And unfortunately, during our process when we had placed my mom into a facility, she did real well with that transition for a few days, and then a lot of anxiety kicked in, and not realizing that there was some medication that she was put on prior from another physician that she didn't do well with. And so she had some side effects. So there was a lot of delusions and anxiety, anger. And so then we had to seek additional help at a behavioral clinic for some additional medication, and went through that whole process and found out a number of months later that she was not on the correct medication, was over-medicated, and had to revisit her medication again. So there was probably a period of 3 or 4 months that she was not properly medicated, and which caused her to really kind of spiral down. And but yet we knew that there was something wrong, and we were able to get the proper help at the clinic here to make sure that she was medicated properly. So that was probably one of our biggest challenges that we faced.
Okay. Anything you wanted to add, Jack?
I agree with what Karla said. And of course, I think when we initially sought out help, my wife was having some hallucinations, and this went on for several nights in a row. So we didn't have sleep time at all. And so that it meant that I guess I had to seek some resources. The point, I guess, with the medication, making somebody more cooperative, I guess, for the staff that are serving them is very important. Things go better for the staff as well as the person. Their day goes smoother, and I think in reality, they get more service from the staff, because staff will generally migrate towards somebody that's more cooperative in their approach to life. And so this went much smoother in the time. My wife, unfortunately, had some physical things where she fell several times, breaking one hip one time and the other hip. And we were able to get to a facility that had a good rehab program, and they got her back on her feet again. So they did an excellent job. So along the way, there are going to be some bumps. I think where I talked about family support, when I walked away from visits, which were almost daily, some days it was a good day, and some days it wasn't. And so the family, just in talking with them or talking about my visits and so on, that support gave me the enthusiasm, as it might be, to go back and visit some more, not giving up. And so I spent a lot of time with other people too every day. So I was communicating with many people that were in the same boat as my wife on different levels. And so I guess I learned a lot about the way they functioned and so on. We have a long way to go to educate people in all areas, not just the layman, but in the medical world also about dementia and how do you deal with people, how you deal with families and so on. And so I guess that's why I'm still interested in sharing whatever things I learned with others, and I still attend a support group.
Great. Thank you so much. Your voice is very much appreciated and valued. Melissa, anything that you would like to say in wrapping up that we missed?
In terms of the challenges?
Yes.
Well, I think the benefits definitely outweigh the challenges, but of course, we touch on very challenging subjects with our care conference, and sometimes the patient and or family is not prepared for what we're going to say or the recommendations we make. Some family members don't agree with each other. There could be multiple siblings involved, but when we as professionals can present the facts to the family, give our specialized recommendations, and then let them just take that and kind of do what they want with it. We're consultants, and so we don't force anything upon anybody. We want them as the family to make the best decisions for themselves, to work with their primary care provider. But the conversations aren't always easy. But they're necessary, and in the end, we think that we're helping these patients get through this devastating disease of dementia.
Great, thank you. And Gregg, how about you? Anything you'd like to add?
I've been to a fair amount of national conferences about Alzheimer's and memory loss, and I see that a lot of what I hear is a model that just doesn't work in a small town. And I think the model that Gretchen has put together works, and it could be replicated. A lot of smaller communities have access to occupational therapy and speech pathologists, and it's a model that works. If we do a referral to a large setting now for this kind of workup, it could be 6 to 12 months. But we can have that work done so much easier. We just find it really works well.
Well, that's fantastic. I know last year I was out in Washington for their rural health conference, and dementia was one of their main things. And they're like, we got to figure out something. We're not a big city. We don't have available to us what so many do. And I'm sure they would love to talk with you and see what you figured out. Lori, anything you'd like to add before we wrap up?
No, I think I'm good.
Okay. And how about you, Gretchen?
Well, I was thinking of one more challenge, I think, for us. We live in a small community. It's 5,300 people. And so many times I run into someone out in the community who I know is struggling with a family member who has some cognitive challenges. To what extent, I'm not aware. But I think there's a misperception out there that either it's normal aging for my parent to be forgetful and maybe fall a lot or forget to take their medications. They think it's normal aging, and I want to so badly say, let us help you. And so I think there's just a lot of misunderstanding, like Jack was saying, a lot of misunderstanding about the disease out there. And it's a challenge for our team to educate the community on what we can do. And also even just physicians, educating them on ways that we can help them help their patients. So that's been a challenge of ours as well.
Yeah, we're seeing more and more of the dementia-friendly communities with more education going on, both in the grassroots and the Dementia-Friendly America, and in Minnesota here, the Act on Alzheimer's program, which was kind of the pilot for that. And I hope that continues to spread, or the memory cafes, which I know Lori was involved with, getting those popped up around too, where offer so much support for people. I think you guys are doing an incredible job, And I can't thank you all enough for taking this time out to share what you're doing, because it is unique and it is making a difference. So again, we've been talking with the Chippewa County-Montevideo Hospital Memory Care Clinic, and they have been doing what they're doing since 2008. So they've had a lot of practice at refining the model. And if you are a community or an organization looking at putting something like this together, please reach out to Gretchen and see how you too can maybe provide this type of service, because it's so powerful to be connected. And I want to thank our family, Jack and Karla, for joining us as well. You added so much to the conversation, and again, it takes all of us to really improve and provide good, positive care. You'll be able to find contact information for Gretchen, Melissa, Gregg, and Lori. Again, if you have other questions, you can always reach out to me, to Lori at alzheimerspeaks.com. Thank you all for, again, participating, and keep up the great work. Really appreciate what you're doing. Bye now.
Hi everyone, this is Meredith from the Senior Fitness with Meredith podcast, where I discuss all things for seniors. From fitness, your health and wellness journeys, how to be all over strong and beyond. I also have my mini podcast called Motivation with Meredith. It's a great, quick motivational pick-me-up for your days. Join me, listen now, search for Senior Fitness with Meredith on your favorite podcast platform.